Project Access is a program that facilitates access to health care for individuals who are uninsured. They have to be at or below 150% of the federal poverty level. That equates to about $30,000 a year for a family of four. Frequently, individuals who are uninsured, if they don't have a primary care physician, they find their resources through the emergency department. The emergency department is a very expensive and costly way to obtain primary health care. If you don't have access to that health care, you're unlikely to have access to the knowledge associated with prevention, health promotion, and even managing a chronic disease. So the education that we provide, we really centers around several different areas. Number one, we want to ensure that individuals have the knowledge that they need to understand what chronic disease is. Number two, we try to encourage them to get into a healthcare system. Number one, to find out if they've got the disease, but number two, to obtain the resources and the information they need to manage that disease. And then thirdly, we educate individuals around the prevention of those diseases and prevention of the complications associated with them. And we feel that as we give that information to individuals, we can, in a very strategic and direct kind of way, eliminate some of the barriers to chronic disease and eliminate some of the disparities associated with it, because the disparity really speaks to a lack of knowledge, a lack of information that you can integrate as part of your lifestyle to avoid the disease or to manage the disease once it's been diagnosed. Chronic illness is a situation in which you've got a disease of some sort that will be with you the rest of your life. However, those diseases can be managed. But the important thing is that the individual has to know what that disease is, and the person has to have access to health care to make the determination that they are hosting this particular disease. The disease can, for instance, diabetes is considered a chronic disease. High blood pressure is considered a chronic disease. Asthma is considered a chronic disease. These